Good evening, everyone. Today I'm going to talk about instruments required for nail avulsion surgery. As dermatologists, we very frequently see patients of ingrown toenails in our OPD. We do prescribe them the necessary treatment if it is infected. We do advise them the precautionary measures and the conservative management. But suppose if the patient is having recurrent ingrown toenail and the patient is not responding to the conservative management, then those patients need to be taken up for nail avulsion surgery. As dermatologists, it is our duty to preserve as much nail as we can. So only that part of the nail should be avulsed which is affected. So we should prefer performing a partial toenail avulsion surgery rather than a total toenail avulsion surgery whenever we get such a patient. How to perform these surgeries? I will be making a video on these very shortly. But today we will learn about the instruments required for nail avulsion surgery. Why we should know all these things? It's because obviously if we will have a proper knowledge about these instruments, only then we will be able to perform the surgery well. And also in our final viva examination, we can be asked to identify these instruments and there we should not go wrong. So let us start with the topic. But before that, I would like to inform you that we make detailed lectures on important topics in dermatology, and the same can be viewed from www.dermacoaching.org. There you will get a detailed list on what are the topics that we have already covered in various modules. Or you can mail us at DERM, that is derm, niharikajha@gmail.com. Now, for doing the nail avulsion surgery, there are two major instruments that are required. One is the nail spatula, and the other one is the nail splitter. What is nail spatula? The nail spatula is something, it's looking like a blade holder that we use for doing biopsies and excisions and all. So, this is very much similar to that. It is actually a modification of Pear's septum elevator. This nail spatula, it is used to lift up the nail plate from the underlying nail bed in an atraumatic fashion. We gradually proceed with this nail spatula and start lifting up the nail plate, and then we proceed further till the time we have reached the proximal horn. We have to take out the horn, and then only the splitting of the nail can be performed by nail splitter. For that purpose, we need a nail spatula for lifting of the nail plate from the underlying nail plate in an atraumatic fashion. So it is like, suppose this is the nail plate and this is the nail bed, then we have to introduce this nail spatula and lift up the nail gradually till the time we reach the horn. Okay. After we have lifted up the nail plate from the nail bed, we have to use this nail splitter. If we don't have a nail splitter, we can go for scissors, we can go for blade, but in the process of cutting the nail plate with the help of blade or scissors, surgical scissors, we might end up damaging the underlying nail bed. Also, if the nail is very thick in nature, then it will be very difficult to get hold of that nail and to cut it with the help of blade or a surgical scissor. That is where nail splitter comes into play. Nail splitter, it helps us in cutting the plate and it does not damage the underlying nail bed. So it gives, a very atraumatic cut, and it can be used in cutting even very thick nails. So nail splitter and nail spatula, these are two very important instruments that you must be having in your minor OT setup if you want to perform nail surgeries. But does the nail surgery come to an end if we have lifted up the nail plate, taken out the horn, and then we have cut the nail plate with the help of the nail splitter? No. After that, we have to curate the gutter which is created after cutting the nail plate. And for curating, we can either use a curate or we can again use a nail spatula. I usually use a nail spatula itself to clear up the gutter, and following which we have to do the process of phenolization. What is phenolization? Phenolization is the process of destruction of the lateral nail matrix, which can be done either surgically, it can be done with the help of laser, it can be done with the common devices such as the radio frequency ablation device or might be electrocautery device. So both these machines can be used for performing the lateral destruction of the lateral nail matrix. But what I use a chemical. Why do I use the chemical? First of all, the healing time is much more when we use surgical methods for doing the process of phenolization. And then handling the chemical is much simpler than handling a machine. So we can simply apply the chemical at the position of the lateral nail matrix with the help of an earbud. What are the chemicals that can be used for phenolization? We can use 88% phenol, we can use 10% KOH, or we can use 100% PCA. What do I use? I usually use PCA only, 100% PCA, because that is usually present in a dermatologist's office, because PCA is used for so many other procedures such as PCA cross. It can be used for, treating molluscum, for treating warts. These are the important things that you must be having in your OT setup if you want to perform a nail surgery. Particularly, I'm talking about the nail avulsion surgery. This includes the nail spatula for lifting up the nail plate from the underlying nail bed in an atraumatic fashion. The nail splitter, which cuts the nail even if it is a thick nail, again without causing any damage to the underlying nail bed. And then there is the PCA, which can be used for the process of phenolization, that is the destruction of the lateral nail matrix. I hope that you found today's topic interesting and you learned something from it. Thank you. Take care.